Now at 5:30, the federal government says it's providing resources to state health departments following an outbreak of the measles. That includes Texas, where a child died earlier this week. It's the first death from the measles in more than a decade. And good evening, I'm Connie Leonard.
And I'm Doug Proffitt. Thanks for sticking with us. Louisville's longtime and top infectious disease specialist is Ruth Carrico, now a U of L adjunct professor and an infectious disease nurse practitioner. Ruth, you helped us in the early days of COVID. Measles. I remember getting a measles shot as a kid. Many adults and everybody wondering, do I need to go out and get another one now? Everybody's really concerned about this.
Well, probably not, and I think the key is just what you said. If you receive the 2 doses of MMR vaccine as a child or even as an adult, then we know that provides us with long-term protection. And what we're seeing now are cases of measles among individuals who haven't been vaccinated.
Mm-hmm. There's a group, though, like that were born in the 60s who are saying may need a booster. Is that the case?
No, 63.
So,
this one
Come
right
on,
here.
Ruth. All right. So here's the lowdown on that. If
Okay.
you received vaccine that was available from 63 to 67, it was a different vaccine than what we have now. It was an inactivated vaccine, and that we know just was not as effective. The vaccines that we have now, live virus vaccines, that means they're very weakened of live vaccines, and those are extremely effective. In fact, if you get those vaccines, that 2-dose series, it's about 97% effective.
So in researching where we stand today, about 25 years ago, measles gone. I mean, it was pretty much eradicated. Is that correct?
Yeah.
Why all of a sudden the flare-up? What has happened? What has changed?
Well, I think that the idea is that, we're not a stationary world. So people move around the planet, move into the community. We go other places around the world. And when you have a population that is not highly vaccinated, then you have the ability for these pesky viruses, they know how to take advantage of settings where individuals are not fully vaccinated. So like the case that we have now in Kentucky, not related to this Texas outbreak, but involves international travel. So it's a reminder, not only is health important every day, but we've got to plan, we've got to think ahead. So if you're going to be getting ready to go on a trip this summer, be thinking about where am I going, what may I encounter, and what do I need to do?
And I want to ask you a question for one of our colleagues. It's a question for a lot of new moms out there. She's a new mom, baby less than a year old. What do you do in that situation?
Yeah, I think babies really don't begin their vaccination until about a year.
Right.
So individuals then that have not been vaccinated, first thing I always think of is talk to that baby's healthcare provider, that baby's pediatric provider, nurse practitioner, physician, say, what do I need to do for this setting?
Well, let's remind people about the symptoms. What are the first indicators that they need to be worried about that something's not right?
Well, probably the first thing that you see is that rash. So you see that red rash, generally see that on the face, then it spreads throughout the rest of the body. If you have a fever and a rash, that should be a key that I need to call somebody. So call your healthcare provider, give them information. They will ask you a lot of questions about what you have done. Now, if you're like me, I don't remember what I did 2 weeks ago. Maybe I remember what I did yesterday. But 2 weeks ago, it's going to be a little bit more difficult for me. But those are going to be questions that providers are going to ask. Where have you been? Who have you been around? And this is a disease, again, of breathing. So it's hard for us to remember. So it all goes back to prevention. How do I prevent? And vaccination is the primary way.
You get flu-like symptoms with it as well. So if you haven't gotten the rash and, yet, you get the flu symptoms first, can you spread it, as before you get that rash?
Well, typically we think when you see the rash, that's when your ability to transmit to others occurs.
Okay.
Of course, nothing is absolute, but that's kind of our key. If you see a rash, someone that has a fever, those upper respiratory symptoms, then that is someone who may transmit to you or to others.
So that fascinating window you gave, 63 to 67, I was born in 63, a year later, I should probably go ahead and get another round of measles shot.
Well, I think check with your healthcare provider. I think that's the clue. Now, some of us are really good about keeping our records, keeping our vaccination records, or making sure that they're in the state's information system. That's ideal. But when you don't know, then talk to your provider. It may be that they recommend a dose of vaccine. They may recommend that you have blood tests done. You can check and see what your titers are. That may be something to do as well. So, you know, again, get some expert advice and then help you develop a plan.
All right.
Okay.
Thank you
so
very much.
much.
Ruth Carrico coming in. We appreciate all of your information.